Okay, welcome everybody. My name is Nettie Kremer, and I'm the Director of the Medical Staff Office, and I am also the Senior Quality Risk Patient Safety Analyst. I work closely with Lori Malloy, and you've probably already seen a couple of her videos during orientation on quality and high reliability. I'm going to talk today about risk management, which is tightly tied to quality, and it's basically one and the same. It just has a little bit different focus. A little bit about me. I have been here at Aspen Valley Hospital for 36 years, coming up May 15th of 2020. So I can testify that Aspen Valley Hospital is a wonderful place to work. And so I welcome each and every one of you to Aspen Valley Hospital. I'm going to start out my presentation with a little joke just because it helps break up the monotony of orientation. I've been telling jokes recently in our incident command meetings, and so I have a stockpile of jokes. And one of my favorites so far is this. What do you call two monkeys that share an Amazon account? And the answer is primates. Anyhow, that's a little joke. So moving on, just going to switch slides here. This is just a little picture of Aspen and how beautiful it is here, just for you to enjoy prior to the start of my presentation here. So risk management. What is risk management? For those of you who have worked in healthcare before, you're probably familiar with other risk management programs. But for those of you who are not familiar with the term, the definition is the process and function developed and implemented to reduce unplanned or unexpected financial loss. Basically, it's making sure we have the proper policies and procedures in place to protect patients, employees, and visitors of our facility. And my next slide. It helps ensure safety for all people at AVH. So know and follow your job procedures and AVH safety standards. Think safety in every phase of your job and in the way you maintain your workstation. Know the National Patient Safety Goals. The Joint Commission publishes National Patient Safety Goals and updates them on an annual basis. We have a little badge card, which I believe you will receive if you haven't already. This one says 2019, but basically the 2020 ones are exactly the same. And it's just little bullet points on how to remember the National Patient Safety Goals. Identify patients correctly, improve staff communications, use medications safely, use alarms safely, prevent infection, identify patient safety risks, and prevent mistakes in surgery. And your specific departments will have policies and procedures on each of the National Patient Safety Goals. So please pay attention to those when you're oriented to your specific departments. Take care of yourself so that you arrive at work well rested and in good health. This is extremely important. If you're not feeling well, you may not be providing the best care for a patient. And certainly if you're not feeling well, you may be spreading disease, which we don't want you to do. And the other thing is to report occurrences, good catches, and adverse events when they happen. And that's the key point of my presentation today, is that we need you as ambassadors for the hospital to report things so that we can improve on things. And we know where our vulnerable spots are so that we can make improvements to processes throughout the house. Patients depend on you for safety. It's your responsibility to provide a safe, secure environment for them. And actually, it's the hospital's responsibility. Through all the years when I've been presenting, I always felt like an ambassador myself to patient safety. And I kept thinking, oh, who do I sound like? Here's a little visual for you. Smokey Bear. Everybody knows Smokey Bear and what he stands for. And so using Smokey Bear as the poster, only you can promote patient safety. Everybody knows Smokey Bear promotes wildfire safety. But I think he can be our poster person, meaning only you can only you can promote patient safety. Does anybody have any idea when Smokey came to be? If not, I can let you know. In the 1940s, and this is actually from Wikipedia, I'm trying to think of, the Advertising Council for the U.S. Public Service came up with Smokey Bear. And at that point in time, in the early 40s, his slogan was, "Remember, only you can prevent forest fires." That was revised in the 80s, I believe, to be wildfires versus forest fires. But the good thing about this ad campaign that they had is that at this point in time, in the United States, about 95% of adults know what Smokey stands for, and 77% of children do. So it was a very successful ad campaign. So when you're thinking about patient safety, think of Smokey and think only you, because basically it is up to us to promote patient safety within the hospital. Some examples of unplanned losses within the hospital might be a patient or visitor fall, equipment malfunctions, medication events, security events, sentinel events. Any of these could lead to an unplanned loss for the hospital. We'll go about talking about sentinel events a little bit later, but a sentinel event is something that happens to a patient that causes harm, and we do not want that to happen again to a patient. So these are just a few examples. Events and mistakes do happen in the hospital, and it's our job to point things out that may go wrong so that there is no patient harm. Moving on, I'm going to talk a little bit about risk management reports that are extremely important. And as I mentioned earlier, we do need everybody to report things as they happen so that we can improve on our processes. So a little definition of an occurrence: it's any situation which is not consistent with the routine operation of the hospital or routine care of the patient. AVH promotes a culture of safety that strives for zero harm and high reliability. Occurrence reports allow us to identify opportunities for improvement, track and trend occurrences, and implement or modify systems to help prevent harm. At Aspen Valley Hospital, we have different reports for reporting occurrences. At this point in time, we do not have an electronic means of reporting occurrences. We rely on a paper process at this point in time. And I'll go over where you can locate our occurrence reports in a bit. But we have a general occurrence report, we have a fall occurrence report, we have a medication event report, we have grievance reports, which I'll get into grievances a little bit later. And then Safe Medical Device Act report, SMDA report. That is equipment issues which should be reported on an occurrence report. I attended a patient safety conference probably about 10 years ago. Which was really something that stuck in my head. There was a CEO that was presenting at the conference, and he said at his orientation for new employees, he asks each employee to report an occurrence within the first 30 days because things do happen, and it's really important that new people as well as seasoned people realize that they play a crucial role in promoting patient safety and risk management awareness in their facility. So please keep that in mind as you begin your job duties here at Aspen Valley Hospital. It's important that everyone report occurrences. Occurrences in the past have had a negative connotation, but we like to think of them as positive things. They are improvement opportunities, opportunities for improvement. So when you're thinking about filing an occurrence report, think about improvement. Okay, moving on to occurrence reports. It's always difficult to figure out what you're going to write on an occurrence report. And at Aspen Valley Hospital, we have made our occurrence forms easy on you so that you don't have to think that you have to write a book. And in this little visual, the poor nurse is perseverating on what to write. And so I'm going to show you exactly what our reports look like and how to report. Our occurrence reports, as I mentioned earlier, are not electronic at this point in time. Hopefully when we come on board with our new EHR, hopefully next year, we'll have an electronic means of reporting. And at this point in time, what you'll need to do is if something does happen, you'll go to the internet page and you'll go to documents and you'll type in occurrence in the search bar. And once you type in occurrence, several forms will come up and you'll select the right one to pick for documenting your occurrence. As you can see on the screen, there's the occurrence report, there's a fall occurrence report, and there's a medication occurrence report. And you would just click that little download arrow with the page and the down arrow, and that would allow you then to print out the occurrence report. And I'm going to show you a copy of our occurrence report. There we go. So this is our occurrence report. You'll notice at the bottom it states, this form is part of the quality management program and should not be copied. Information contained in this report is protected by federal and state law, including the HCQIA, which is Healthcare Quality Improvement Act of 1986. And that's really important because this allows us to report occurrences and to do follow-up on occurrences without fear of having the information discovered should there be some sort of a lawsuit against Aspen Valley Hospital. So you'll notice on this, it's just one page, maybe 2/3 of the way down, there's a narrative description, which gives you 3 lines. We don't want you to write a book, and we don't want you to feel that you have to spend a lot of time on this. Basically, we just want you to report. We want you to report only the facts. You don't have to give opinions. We'll leave the opinions for when the department manager researches and investigates the occurrence. You can give your opinion at that point in time, but this is just a way for us to report in an expeditious fashion. Expeditious? That's not a word, but anyhow, in a fast manner that something did happen. So basically the patient sticker goes on the top, who was involved, getting to the significance portion, which is not quite halfway down. We document good catches on our occurrence reports. And I'll talk a little bit about that later, but basically you're going to check whether the event reached the patient and caused no harm, whether it's a patient safety event, whether it's an adverse event, or whether it's a sentinel event. And then you get to the actual type of event with just a little checkbox. Most of the time they're treatment or procedure errors or concerns. And then you'll give your narrative, what initial action was taken, and then a name. You don't need to put your name on it, but it is helpful if you put your name on it, just so that we know who we can follow up with. The other good thing about putting your name on a report is that on a quarterly basis, we do a drawing as an incentive for people to report. We do 3 drawings on at the end of each quarter. We do a drawing for good catches that are reported. We do a drawing for occurrences that are reported, and we do a drawing for medication events that are reported. And the drawing is done at the monthly meetings with the clinical managers. We pull a name out of an envelope of all the people who did report, and we put those awardees in a quarterly newsletter that Lori Malloy puts out and alerts people that they did win a prize. So please do report. That's the key thing that we want to talk about today is please report occurrences. I'm going to go back one slide just to go over these again. So on the occurrence report, only the facts. We're going to make sure that we document that something did happen in the record. If it's a good catch, we don't necessarily need to document anything that happened, but if there was an event that happened, such as a medication event or a patient fall, you're going to document that in the record. You know, you're going to document perhaps if it was a fall, that the patient was found on the floor, they were assisted back to bed, and the physician was notified, and any orders that were given. We're not going to document in the record, though, that an occurrence report was filed. And again, this is because our occurrence reports are part of the quality management process, which do have some protection. And then again, we're not going to copy the report and keep it in our locker because if you keep a copy of the report, that it is not protected. So if you have any questions about that when you're filing a report, please feel free to give me a call. Moving down the line, oh, I missed my page. I'm going to talk about grievances. I've talked about occurrences and medication events, falls. Now I'm going to talk about grievance. What is a grievance? A grievance is an unresolved patient complaint. Most of the time, if a patient is in the hospital and if they have a complaint, you know, they voice their concern to the nurse manager perhaps, or the house supervisor, or even just the staff nurse. We have a service recovery program, which I believe you're going to be oriented to as well. And hopefully at that initial contact of a complaint, we'll be able to resolve the complaint. But if not, the complaint can go into a grievance. A grievance is an unresolved patient complaint. And we have a whole process for grievances. The form is located on the intranet. And again, you'll go to documents and then you can just type in grievance and the grievance form will come up. And here is the grievance form. You can print that out and then the patient can complete it. On the back of the page, it talks about who the grievance can be filed with. There's also instructions for contacting the state of Colorado, as well as the Joint Commission, should they want to file a grievance with them. But basically, once we get a grievance, we process it through the grievance committee and the patient will be contacted with a resolution, hopefully within a couple of weeks. Sometimes things take a little bit longer just due to the nature of how we need to investigate. But we do follow up with the patients and per the CMS and state guidelines, this is a requirement. So it's really important that if a patient does express a concern, that you give them the option to file a grievance if we can't resolve their concerns. And again, if you have any questions about this, please feel free to contact me. Moving on. What happens when a report is filed? Good things happen. And I want to say that again, you know, we encourage occurrence reports and we want you to file them because good things will happen when you file an occurrence report. We'll do an investigation. We'll figure out what we need to do to improve things so that this does not happen again. And on the back of the occurrence report, when you print it out, there'll be 2 pages. There'll be the actual form, but this is the sort of algorithm that we have. So an employee files the report gets filed with the house supervisor or the department manager. It gets routed to my department. We log every single occurrence that comes in on a spreadsheet. We then on a monthly basis, with most of the clinical managers, we go over every single occurrence and whether or not harm happened to a patient. And then we determine whether or not there is appropriate follow-up action so that this does not happen in the future. And this is really important because I spoke a little bit earlier about Lori Malloy sending out an update with regard to quality and high reliability. Part of her update is a summary, and I'm just going to show you here what it looks like. But it's a summary of the month prior's occurrences, medication events, patient falls, and it gives us a breakdown of how many were good catches, how many caused patient harm, what the strategy is so that this does not happen again. And that's what's really important about this, is we're being transparent and we're identifying the error, we're noting whether or not it reached the patient, and then we give prevention strategies, things that are something to consider in each department, not just the department where the event happened. And this will help us become a high reliability organization. So pay attention when these come out on a monthly basis. Lori sends an all-employee email, and usually they'll come out by the third week of the month after. So I'll look forward to those. And I'm going to give you a few examples. This is what I was showing you in a visual. We have the medication error categories with a year-to-date summary. And in this month, there was a delay in receiving meds, there was wrong meds, there was wrong doses, on and on. The next page will actually show you the error, whether or not it reached the patient, and prevention strategies. This moves into the occurrence types, and we're doing the same thing. So you can see in November of 2019, there were 4 occurrences. 1 was a good catch. A little bit about good catches. Our goal at Aspen Valley Hospital is to have 50% of our occurrences be good catches. We want people to report things that they have caught before they have reached the patient. And that's the proof that we have a good reporting system. So when you're at work, if you're doing your daily duties and for some reason you catch something that almost happened to a patient, please report that. That's really important to us becoming a high reliability organization. This gives you a little bit more on the good catches. And again, the way we report good catches is to fill out an occurrence form and then just check that box, good catch. We don't have to do the follow-up on a good catch that we do on an occurrence. So it's no extra work on anybody's part. So please report your good catches from your coworkers, from yourself, from physicians that you work with, on the occurrence report. And again, we try to be transparent, so we post these on our intranet. And we notify everybody that this is something that happened and it was a good catch, and we reward people for that. This is just a visual of our intranet page, and as you can see in the bottom middle, we have Good Catch Dr. Franzi, and you can click on that little read more box there, and you can learn exactly what Dr. Franzi did as a good catch. Sentinel events and root cause analysis. For those of you who have worked in hospitals before, you're probably familiar with Joint Commission Sentinel events. And the definition of a sentinel event is up there, but basically it's something bad that happens to a patient that causes harm. And of course, we don't want that to happen. It's also near misses, things that almost cause patient harm. So if something were to happen and we didn't catch it on time, such as a good catch, we would want to look at that and make sure that we have a good process in place so that it doesn't cause harm the next time it happens. So we have a process here at Aspen Valley Hospital where we do root cause analyses, and we get the group together that was involved in the event or those that know the most about the process, and we try to figure out what the root cause of the event was. We keep asking why until we get to the root cause. We use a format from the Joint Commission for conducting the root cause analysis, and we ask all kinds of questions related to staffing, related to information technology, related to the environment of care. We don't want to miss anything. We don't want to go into the root cause analysis meeting thinking, oh, we know why this happened, because we really don't know why these things happened. Throughout the years, the Joint Commission has been collecting data on root cause analyses and have learned that in most of the cases, orientation and education, as well as communication, are at the root cause of things that happen. And that's why it's really important for you to attend orientation, for you to pay attention at orientation, and also to really be involved in your department orientation to make sure that you are comfortable with the processes and the policies that we have here at Aspen Valley Hospital that allow you to do your job effectively and with patient safety in the middle of the box there for us to pay attention to. I'm going to show you a visual of our root cause analysis form. So basically when we get the group together, we look at what happened. We discussed what we can do to prevent it from happening again. This one happened to be a medication event. This was actually during one of our Joint Commission surveys when this happened, but this led to some great improvement opportunities. I'm going to show you the next screen, which is the corrective actions that we put in place, so having to do with medication orders. And the bottom one here, it says action item number 6. We're going to add these meds to the look-alike, sound-alike list, which was done in this case. A little bit more on events that happen. We can do a failure mode and effects analysis ahead of time before something actually happens. And if FMEA, I don't know how many of you who have participated in I don't know how many of you may have participated in an FMEA in the past at your prior facilities, but this is something that's similar to a root cause analysis, but we're doing it proactively. We maybe have a process that everybody does a little bit different, and we know that there's a better way to do it, so we'll do a failure mode and effects analysis to figure out where the process can fail and how we can make it better so that it works the way it should work in the future. And it's sort of a fun thing to do. We use a tool from the IHI, which is the Institute for Healthcare Improvement. And this is just an example of one that we did. This was on OR workflow. And as you can see, basically when you're doing FMEA, you outline all the steps to a process, and then you come up with failure modes, causes, and effects. You come up with a score, and then you know where to focus most of your efforts. So you can look forward to this. Joint Commission requires that we do this at least every 18 months. And at Aspen Valley Hospital, we probably do this at least a couple times a year with a process that we know is a little bit cumbersome. We are accredited by the Joint Commission as a critical access hospital. Our last survey was in October of 2019. We had a pretty good survey, and part of the survey and part of the requirements per Joint Commission is that we have a quality reporting process in place and a mechanism for staff to report issues of patient safety or quality to the hospital, as well as you can report them directly to the Joint Commission. Aspen Valley Hospital will not take any action against an employee or a physician for reporting to the Joint Commission. And that's basically just the gist of this slide. So please feel free, if you have any questions about this, to contact me, or you can just go on the Joint Commission website as well. I'm drawing to the close of my presentation. Hopefully this has been helpful to you. If you have any questions at all, please feel free to contact me. But again, the point of my presentation today is that we do need to report for good risk management, for good quality of care, for good patient safety. And so make that one of your priorities when you work, is to alert us to things that aren't working as well as they should. And I hope to see you all in the hospital. Please feel free to stop me in the hallway if you see me and say hello, or to ask a question. But again, welcome to Aspen Valley Hospital, and have a great day. Thank you. Bye.